Gallstones after gastric bypass surgery are common. In fact, in the early days of gastric bypass, it was very common and routine to also perform removal of the gallbladder. We don't do that anymore because we're doing the surgery laparoscopically now, and a lot of the drive toward a simultaneous removal of the gallbladder at the same time as bariatric surgery was driven by the fact that it was an open surgery and a lot harder recovery. So over time, we really don't perform those two surgeries at the same time. And in my practice, I typically try to avoid it if at all possible, because I think it increases the risk of both of the surgeries. My general philosophy is if you have two medium surgeries, it's safer to do them as two separate surgeries rather than two medium risk surgeries at the same time. Complications don't add, they multiply. So by taking on two surgeries, each with their inherent risks, you increase the chance of having any problem. But not all surgeons have that viewpoint, and there are certainly some exceptions to that rule, and that's a very complicated and individualized discussion that I have with patients. But gallstones after surgery, which is what we're really talking about here, are caused by rapid weight loss, and the more weight you lose, the more likely you are to have gallstones. We see it in about 10 to 15% of patients within the first 5 years after surgery. So that's pretty substantial. We're looking at somewhere between 1 in 6, 1 in 10 people will need to have their gallbladder removed in the next 5 years after surgery. Now, gallbladder removal is a pretty common procedure, but still we don't see nearly these kind of rates in the general population who require gallbladder surgery. It most commonly occurs in the second year after surgery, right around 20, 24 months, somewhere in that range. That's the most common time when people will require removal of their gallbladder. Now, the symptoms of gallstones are fairly classic, and they're essentially abdominal pain after eating. There's almost always an eating component to it until it progresses and gets too significant, at which point it becomes a constant pain. But typically patients will say, every time I eat, for 20 minutes, an hour or so after surgery, after I eat, I'll develop an upper abdominal pain. Sometimes it radiates to the back. Sometimes it's associated with nausea. It's usually in the center, not the right side as most people think. Some more sinister and worrisome things that we can see are very dark urine. Now, that's not just a little bit dark, and especially those people who take vitamins oftentimes will have fairly bright colored urine. This is like the color of iced tea or Coca-Cola, like an incredibly dark color. And stools will be clay colored, not a little bit light, but zero brown at all, almost like a gray color to the stools. When you see those problems, the dark urine or the clay-colored stools, it's time to seek medical treatment immediately. The abdominal pain typically is also something that you shouldn't delay, but doesn't always require a trip to the emergency room because it's usually fairly self-limited and requires and resolves after 20 minutes to an hour. When it keeps going and going and going and doesn't go away, that's when it's time to seek immediate medical treatment. So why are gallstones after a gastric bypass so difficult and challenging? And it really has to do with the anatomy. Now, if the gallstones are isolated and just really located in the gallbladder themselves, it tends to be a fairly straightforward surgery. We do know that there's a slightly higher incidence of complication when you take out someone's gallbladder if they've had a gastric bypass compared to if they haven't. But it's a generally very safe procedure. So even if that complication rate is 50% higher or twice as high, it still is a small amount of patients who have trouble. So when the gallstones are isolated and stay in the gallbladder, it tends to be a little more complicated than your average patient, but it still really tends to be an outpatient procedure and safe without a lot of long-term problems. The biggest issue is when these stones travel down and get stuck in the main liver duct. So the main liver duct dumps into this first portion of the small intestine called the duodenum. Now, when a stone gets stuck there, it can cause this dark urine. It can cause the absence of color in your stools, and it can cause some of your liver function tests to really go up. You can end up getting very, very sick from this if you get an infection in the main liver duct. So the typical treatment, and this is a fairly easy thing to diagnose, you can almost diagnose it just by talking to someone and with some basic inexpensive blood work. And when you see this, the typical treatment is to have a patient undergo an endoscopy where the endoscopist goes in and basically fishes the stones out from below. So they go through the mouth, through the stomach, into the first portion of the small intestine, and will fish those stones out from below. Now the problem is when you've had a gastric bypass, we have disconnected this segment of the stomach from your mouth and esophagus. So you no longer can go. If you go this way, you'd have to go all the way down the small intestine and all the way back up to get to this section right here. And that's really almost impossible to do. There are some centers that will do it, but in my opinion, I don't think it's the safest or smartest way to do it. So if that stone is to travel, at about 10% of gallstones will travel and get stuck, what we have to do is go to the operating room and we'll remove the gallbladder, and then I'll make an incision in the old stomach and have the endoscopist come in and put the endoscope in through the old stomach, and then they can get there. And the truth is, I've worked with a couple of endoscopists and we've really got this down pat, and it can be done very safely, but it certainly is more complicated, more difficult, requires more expertise than just having your gallbladder removed if you haven't had a gastric bypass surgery. So that's really an important thing to acknowledge and understand, is that if that stone travels from the gallbladder into the main liver duct after a gastric bypass, it's a difficult problem and it requires some expertise, typically from a bariatric surgeon. So some advice I give to my patients about gallstones are, first of all, don't delay removal. If you're told you have gallstones, this is not the kind of thing where you say, well, you know, let's just wait until next summer or next fall or whatever. In general, I recommend, if you have symptoms and if you have gallstones, that you should get them removed. Now, if you don't have symptoms, it's not quite so urgent, but it really is important to keep a very close eye, and if you develop any kind of symptoms, you should get the gallbladder removed relatively quickly. Because the complication rate increases dramatically if that stone travels and gets stuck. And we also know that the complication rate of having your gallbladder removed after a gastric bypass is slightly higher than if you have not had a gastric bypass. The key really is early intervention, because if you intervene early on this, it really is a relatively safe and simple procedure. And even if the normal complication rate after having your gallbladder removed is 1 to 2%, so if we go to 3 or 4%, if you've had a gastric bypass, that still is greater than a 95% chance that you're not going to have any problems whatsoever with this procedure. And another thing is, you know, I don't know any bariatric surgeons who don't also perform gallbladder removal. It's really in the same area. We were trained to do this, and we also have that ability to enter the old stomach and have a good understanding of the anatomy and the best treatment for this, and have probably dealt with it more than most other surgeons. So this, again, is the kind of problem that you want to bring your bariatric surgeon into, and not just show up at your local ER and kind of see what happens. If it's a routine gallbladder without the stones being stuck, then I think that is reasonable. But anytime this gets complicated, it's time to get a bariatric surgeon who really understands the anatomy of a gastric bypass in. So the bottom line is, gallstones are frequent problems after a gastric bypass, and the new anatomy makes treatment more difficult and dangerous. And so it's really important that you don't delay treatment. You get it taken care of before it turns into a much bigger problem than it really has to be.